Hello all, myself Dr. Vinita Baghela, clinical nutritionist, women health practitioner, gut health advisor, antenatal and Garbh Sanskar coach, nutrition and life coach. So let us talk about what are the reasons that leads to PCOS and PCOD. So we have discussed earlier in the first series what is the thin line between PCOS and PCOD. So as per the first series, we know that PCOS is because of genetic predisposition and PCOD is because of the lifestyle, or you can say the poor dietary habits. So what are the things which are in control of our life? What are the things that we can do to help the PCOD clients? So talking about majorly PCOD, we will be focusing on what are the risk factors, what are the things that aggravate PCOD, and how we can treat the symptoms. PCOS and PCOD are generally seen in the reproductive female age group, and they are basically because of the disturbance in your endocrine system or endocrine gland. So what are the symptoms? The symptoms are irregular periods, scanty periods, or amenorrhea. Then there is increased facial hair growth on face and other parts of the body. The other symptoms are irritability, mood swings, mood fluctuations, energy draining, or you can say fatigability also increase in PCOS and PCOD. Some patients' sleep apnea or sleep disturbances can also be seen. So, what are the major risk factors because of which PCOS or PCOD occurs? It occurs because of increased stress level. Secondly, it occurs because of the absence of physical activity. And third, it occurs because of excessive consumption of processed food or junk food in our diets. So, we'll talk one by one how these factors influence our life. So, we will talk about the increased consumption of processed food and the decrease in physical activity. So, they cause havoc in our hormones. What happens? There is a communication with our master pituitary gland and ovaries, and when this communication is disrupted, it leads to hormonal imbalance. So when we consume increased amount of junk food in our diet, there is hormonal imbalance, which in turn leads to hyperandrogen state, or you can say that there is increase in the male hormones in the female body than the female hormones. So when this stage occurs, when the male hormones increases in the female body, then the ovaries are unable to produce the right number of eggs, or the ovaries are unable to ovulate. So when the ovaries are unable to ovulate, then there is menstrual irregularities that has been noticed or seen in PCOS and PCOD clients. So what happened? Initially there is scanty or a less number of period cycles, or you can even notice 2 to 3 months break without periods. So this stage can finally leads to amenorrhea. Now, the second most important thing that we need to know about PCOS and PCOD is insulin resistance. What happens? As we all know, insulin is a hormone produced by pancreas in our body. So, when glucose is increased in the blood, the function of insulin begins. Insulin is secreted in the blood and it takes up the glucose and transport it to other cells. But in PCOD, what happens? Because of the increased level of insulin hormone is unable to do the work. So the excessive glucose remains in the blood and the state is known as hyperinsulinemia, or it can finally leads to insulin resistance. So what happens if there is increased insulin in our blood or the patient is prone to insulin resistance? Then the symptoms will be increased weight gain. Secondly, the periods will be irregular. Third, there will be disturbance in the sleep cycle and mood swings. And finally, it will create a miserable life and havoc in some female clients. Okay, so we have discussed a lot about PCOS and PCOD. What are the causes? What are the symptoms? Now, what are the risk factors which are associated with PCOS and PCOD if it is left untreated? Female clients are more prone for cholesterol abnormalities. Secondly, female clients are more predisposed for endometrial malignancy. Third thing, these clients are more prone for cardiovascular diseases. And fourth and the most important, they are always in a chronic stage of inflammatory state. So it should never be untreated. If you feel any symptoms, if you feel any of these above symptoms that we have discussed, you should refer to your doctor and take adequate treatment. Thank you.